You will be student doctor number 1. You will be student doctor number 2. All right, we have 2 more minutes before we begin, so you guys can do whatever with the time here.
Okay, is it okay if I fill your PSIs?
Yeah.
Okay,
They're like right here.
right there.
Yeah.
Okay.
I have like a mouth scoliosis. Just so you know.
Okay.
I'm practicing.
Okay.
Yeah. Can I fill your?
Yeah, of course. Mine are a little lower.
So like there.
Yeah.
Okay.
Yeah,
Cool.
right there. And then I do have some flat feet as well, and then I have a tattoo. Okay, so just be aware of that.
Good to know. Okay. Cool.
All right, we are going to begin.
Okay.
Please enter the room.
Oh yeah. Go ahead. You have 1 minute to set up.
Okay, would you mind being on this table?
It's like you're disengaging it, and then you're putting it back in. Like you take your drawer out and then moving it up and then back in.
Okay, I have ribs and lower thoracics. Okay, I'm student Dr. Cameron. I'm going to be doing your structural exam. Do I have permission to palpate?
Yes.
Okay, walk towards me and away, please. I'm looking at your cadence, your stride length, and your arm swing. They all do look appropriate for your height. As I'm looking at your feet here, I'm noticing some out-toeing, more so on the right foot, and then I am noticing some pronation on that left foot. If you can go ahead and stop here. Yeah, so I am noticing some pronation on that left foot. If you can go ahead and lift that foot, please, and the arch does reform, and then lift that right. I want to make sure it stays there. The arch does stay there. So that is a pes planus on the left-hand side, and that is going to be a functional pes planus because the arch did reform when he lifted his foot. If it didn't reform, it would be more indicative of an anatomical pes planus on the left. Looking at the knees here, I'm not seeing any genu varum or genu valgum. And then looking at the eyes, I'm seeing that the left eye is inferior. The right earlobe, inferior earlobe, is inferior. And then overall, the right side of the face is more full. I'm going to feel for your TMJ here. If you can go ahead and open and close your mouth 2 times. Okay, and I'm not noticing any chin deviation or crepitus or grinding in the TMJ. And then I'm looking at the head on the body. I'm not noticing any side bending or rotation. As I'm looking at the shoulders here, I'm noticing that left shoulder is superior. Let's test the function of the shoulders. If you can take your hands, the palms all the way up and together, and then the backs all the way up and together. Okay, so the biceps were able to touch the ears at both points, so that is a negative upper extremity quick test, less likelihood of an upper extremity somatic dysfunction. I'm going to go ahead and check for pectus carinatum or excavatum. It's a sensitive area, okay? If anything's uncomfortable, let me know. I'm not noticing any pectus carinatum or excavatum as well. Feeling for your rib symmetry and contour. I'm feeling that that left side is more anterior and full. I'm going to go ahead and do my derm exam. If you can go ahead and get an anatomical position. I'm noticing some erythema at the left clavicle. And then I am noticing some scattered papules on the left side from about rib 1 to about rib 4. I'm noticing some erythema on the abdomen above the umbilicus on the right-hand side. And then let's go ahead and do your side view. So if you can, oh, and then I'm going to check the lower extremities as well. I'm noticing some erythema at the right anterior shin as well. If you can go ahead and face that side wall, please. I'm going to check your spinal curvatures. So the cervical lordotic curve is a little excessive. The thoracic kyphotic curve is a little flattened. The lumbar lordotic curve seems also a little flattened as well. Let's check your gravitational line. If it's anterior to the lateral malleolus to the greater trochanter, is in line. The greater trochanter is in line to the acromion process, and the acromion process is posterior to the external acoustic meatus. Overall, I'm seeing a forward head carriage, just a slight forward protraction of the scapula. Let's do a squat test. So if you can keep your heels on the ground, arms forward, come all the way down as low as you can, and back up. Okay, so your heels stayed on the ground, you were able to get to 90 degrees in the knees, so that is a negative squat test, a lower likelihood of a lower extremity somatic dysfunction. If you can go ahead and turn to the back wall, please. Looking at your derm exam on the back, I'm noticing some scattered erythema from about T1 to about T12 bilaterally with some scattered papules bilaterally. And then looking at your lower extremities here, that is unremarkable. Okay, let's go ahead and check for scoliosis. If you can tuck your chin to your chest and come all the way down, down, down. Okay, and come on back up. Okay, and stop. So I'm noticing from about T1 to about T7, there's a left rib hump. Go ahead and side bend to the right like you're driving a car, Kevin, and go left. Okay, stop, come on back. So come on all the way up. Okay, I had a rib hump off to the left from about T1 to T7. Apex seemed to be around T4. It did resolve in right side bending, so it's more indicative of a functional scoliosis. If it did not resolve in side bending, that would be more of a anatomical scoliosis. Go ahead and take your hands behind your head or behind your back. I'm going to check for your inferior scapular levels and remove them. Thank you. Right scapula is inferior. And then give yourself a hug. I'm going to check for posterior rib angles. You tell me if you're feeling any tenderness, okay? All right. I'm coming here. Okay, I'm noticing a posterior rib angle at about rib 3. Any tenderness here?
No.
Okay, rib 3 on the right, I'm noticing a posterior rib angle. Any tenderness here?
Yeah.
Okay, tenderness noted at about rib 8 on the left, and that is a posterior rib angle. Okay, and nothing else. Okay, if you can go ahead and bring your hands back down, let's do a hip drop test. If you can keep your feet on the ground, bend that right knee, okay, and come on back, bend that left knee. Okay, thank you. So I'm noticing a contralateral swing of 20 to 25 degrees bilaterally. That is a negative hip drop test and a less likelihood of a thoracolumbar restriction. Let's check your iliac crest levels here. So they are level, so no shim is needed at this time. Let's go ahead and come in front of this chair here. I want to check your SI and your IS test. Okay. Checking for your PSISs. Okay, come all the way flex forward. Forward. Okay, and come on back up. Left excursion of the innominate and the iliosacral dysfunction test. All right, and then go ahead and try it again. And thank you. So no excursion of the innominate. Negative sacroiliac test bilaterally.
Permission to pop it?
Go for rib 8, because I just have the bottom of the side of the heel.
Alright, you could flex forward for me, please.
I get lazy.
And back. And have a seat. If you could flex forward for me, please, again. And, yep, I agree.
Okay. So that's a higher likelihood of iliosacral dysfunction on the left. Okay, let's go ahead and have you straddle the table. Kevin, I want to check your active range of motion in your lower thoracics. We're going to start by defining our region. I'm at finding T5. Inferior level of the scapula is T7, and then we're going to move up to T5, and then find that 12th rib, and that is T12. So my region spans here, right there. So I'm going to start by checking your flexion. If you can go ahead and flex forward and stop. Thank you. And then come on back. All the way up, chest to the sky, and stop. Okay, thank you. So it seemed to move as a unit in extension, more segmental movement in flexion. I'm going to come to your back view here. If you can act like you have dumbbells in your hands, go ahead and drop to the right and stop. Thank you. And then come on up, and then go to the left and stop. Thank you. So more moved as a unit in left side bending. Right side bending was more segmental. If you can put your arms in front of you like a hug, like you're going to turn to the right, please. And stop. Thank you. And turn to the left. And stop. Thank you. I'm getting segmental movement in both right and left rotation. Let's check for tissue texture changes. So I'm going to start with temperature, calibrating at the level of the heart at about T3. It is warm bilaterally. I'm going to move up. As I move up into about T1, it starts to get cool. As I move to the base of the occiput, it stays cool bilaterally. I'm moving back down, and it gets warm as I move to the heart. As I'm moving through about T7, T8, it's getting cool. And it stays cool bilaterally. As I move down at about T12, L1, it starts to get warmer bilaterally. And then it cools down as I move past about L2, L3, bilaterally, and all the way down. Okay, I'm going to check for any tenderness. You tell me if you're feeling any pain, okay? Starting at the base of the occiput, I'm moving down. I'm noticing some body tissue bilaterally. Any pain here?
No.
Okay, any tenderness here?
No.
T1 bilaterally, I'm noticing some body tissue. More of an acute change. As I move down here, I'm getting some ropey tissue. Any tenderness here?
A little.
Okay, ropey tissue on the right-hand side at about T7. Okay, and then I'm getting ropey tissue bilaterally at about T12, L1. Any pain here?
No.
Okay, any tenderness here?
No.
Okay. And then I move back down. Okay. And then paravertebral fullness. That right side is more full, especially here at about T1 to T7. Okay, and then I want to check your passive range of motion on your ribs. So if you can go ahead and lay down, Kevin. Okay, we're going to start by assessing the quality of motion of rib 1. I'm going to slip under the trapezius and find that rib 1 and be very gentle. Okay, great. So if you can go ahead and take a big inhale and big exhale. Okay, right side seems inhaled. Oh, I'm actually going to stay here. So I'm going to check ribs 2 through 4. It is a sensitive area. If you'd like to cover up, that's okay. And then I'm going to go ahead and assess your motion. So go ahead and inhale and exhale. Okay, and that left side is inhaled. I'm going to come around here from 5 to 7. Xiphoid process is rib 7, and then I'm moving 2 more up. Go ahead and inhale and exhale. Okay, that seems symmetric. And then ribs 8 through 10. I'm going to check first for compression and compliance. Okay, and right side is a little more restricted. Go ahead and inhale and exhale. Okay, and that seems normal. If you can go ahead and flip over, I'm going to check ribs 11 and 12. Okay, ribs 11 and 12, caliper motion. Go ahead and inhale and exhale. Okay, that is normal as well. Okay, so flip on over here, Kevin. I thought that your ribs 2 through 4 was more inhaled. So I'm going to start by trying to find the key rib. Remembering my bite mnemonic, I'm going to start with the bottom for inhalation. I'm going to start with rib 4. So finding rib 2, 3, and 4. Okay. Go ahead and inhale and exhale. Okay, and I do think that that is my key rib because 4 stays up. Just to verify, I'm going to go down 1 more to rib 5. Okay, go ahead and inhale and exhale. And that was symmetric, so that means rib 4 is my key rib on the left-hand side, inhaled.
All right. Permission to palpate? Yes. All right. So 2, 3, 4. All right. If you could breathe in for me, please. All right. I agree with your diagnosis. All right, your 2 treatments are lateral recumbent thoracic soft tissue and supine rib raising.
Okay, we're going to start with our thoracic soft tissue. Kevin, if you can go ahead and turn to me on your side, thank you. I'm going to start by doing a soft tissue technique. I'm going to go ahead and grip under the, paraspinals here, and I'm going to do a soft tissue technique. What this is doing is this is going to break up our cross links and digging into the tissue here. What soft tissue is it encourages glycosaminoglycans to come into the site, and this is decreasing tension in the muscle. I'm bowstringing the paraspinal muscles as I do this with proper ergonomics. And then as I get low enough, I'm going to go ahead and switch my arms here. And then I'm going to continue the treatment. Soft tissue encourages proper circulation and blood flow to the site. I feel more compliance. And then I'm going to move back up. This is a bilateral technique. All right, and I am feeling more compliance in that tissue as I'm moving through at tissue speed. Okay, and then one more time. All right. And then we're going to do the other side, Kevin. So if you can go ahead and flip over to the other side. Okay. And once again, I'm at the paraspinals here. I'm going to move slowly, and I'm going to bowstring those muscles, encouraging movement of the scapula. Once again, soft tissue is a slow. It is a direct and passive technique. I'm directly engaging that tissue, and it's passive because the patient is not helping me with the treatment as well. Like I said before, I'm encouraging the breaking up of crosslinks and the increase in gags to the site. Okay, and then one more time. Okay, and then I am feeling more compliance in this tissue as I move. And I'm going to do one more time here. All right, and I am getting more compliance, and I'm noticing some hysteresis or some red reflex as well. Okay, so let's go ahead and retest by checking our tissue texture changes. If you can straddle the table here, maybe facing that way. Okay, we're going to continue by doing temperature. Yeah, it's staying warm as I'm at the level of the heart. Quickly checking. Okay, yep, it gets warm, and I'm moving through my treatment region, which is warm bilaterally, and it stops at about T12. Moving down. Yeah. Okay, and then it's cooler in the lower, in the lumbars. Any tissue texture changes here? That boggy tissue is still there. Moving down, and I am getting more compliance bilaterally in that treatment region as well. Okay, and then paravertebral fullness. Yeah, and I'm not noticing that right side more full. I'd say it's symmetric. Okay, let's go ahead and do our supine rib raising. If you can lay on your back here. Our supine rib raising is an articulatory technique, and what it's going to do is I'm going to make contact with the paraspinals here at the posterior rib angles. And what I'm going to do is I'm going to use my arms as a lever and a fulcrum to lift those ribs and encourage more compliance and articulation of the ribs. What I'm also doing is I'm attenuating that sympathetic nervous system by continuously stimulating it, which will go ahead and turn it off and encourage parasympathetic tone to the body. I'm going to continue doing this until I feel more compliance, which I am starting to. All right. The goal of articulatory is to, like I said, attenuate that sympathetic nervous system and encourage symmetric motion of the ribs. All right, and then I'm going to go ahead and do that other side as well, as I felt more compliance. All right, and then I'm going to go ahead and make contact with the posterior rib angles. All right, and then once again, I'm going to go ahead and use my arms as a fulcrum to encourage proper range of motion in the ribs bilaterally. Moving down here. And I'm feeling more compliance in the ribs as I move down. Okay. Yeah. And I'm encouraging proper circulation as I move here. All right. And then I'm going to do one more. And this was a direct and passive technique. Direct because I'm directly engaging those barriers, and passive because the patient is not helping me with our treatment. We're going to retest by doing our chart changes one more time. If you can go ahead and straddle the table. Okay, come on back towards me, Kevin. Okay, we're going to reassess by checking our tissue texture changes as well. So I'm going to start calibrating at the level of the heart at T3. Bilaterally it is warm. Moving up, it's getting cooler as I move to the base of the occiput, which is to be expected as before. Moving back down, it's getting more warm as I move through my treatment region. T5, 6, 7, it's getting warm bilaterally. Moving down, it's getting cooler as I move through T12, L1, L2. But it starts to get warmer at about L3, L4 bilaterally. And it stays, or it gets cooler as I move through the rest of the spine. I'm going to check for any tenderness. Okay, still have that boggy tissue at T1 bilaterally. Moving down. And the whole treatment region seems a little more symmetric. And then I'm still getting that ropey tissue at T12 bilaterally. And then it continues as I move down through the lumbars. and then per tubal fullness. And I'd say they are symmetric this time around. Okay.
Time is yours.
Okay. So let me make sure I got everything.
Yes.
All right, if you could clean up and we'll walk over here for some feedback. So how did you think you did?
I thought I did pretty well. I think I got everything I needed to. There were some points where I wasn't quite sure what my next move was, but you know, I just had to take my time, and I think I did okay.
Yeah, I think you
Yeah.
did great.
Okay.
Honest, have you considered VKTA? Because like that was a flawless run. I could tell you practiced a lot for that.
Oh, thank you.
Yeah, so things I really like that you did, for example, on your derm exams, I like how you went all the way down because a lot of students tend to forget the fact that, you know, we have lower extremities and there's derm findings that you could have there.
Okay.
You verbalized everything, you know, bilateral or is it left-sided, right-sided, especially with the temperature changes because students also tend to forget that you comment on that bilaterally. So great job there. And I really liked how you defined your region for your active and passive range of motion because it made it very clear to me that you know what regions you were looking at specifically, and you commented well on them as well. For your techniques, you also did, you know, executed them perfectly. You know why they work. The only thing I might comment on, honestly, this is kind of being nitpicky as well, is that for your articulatory, for the rib raising, you could also mention that, you know, while you're going against that restrictive barrier, you are also breaking up cross links and also increasing those gags or glycans, excuse my stuttering. And then one more thing on the TART changes as well. I just thought about this, is that, you know, after you do a treatment, you might have, you know, increased warmth for a reason, right? And so what's the word we're looking for there?
Hysteresis.
Yeah, exactly.
Red
So,
reflex.
you know, increasing that blood flow to the area,
Okay.
inducing that hysteresis. So otherwise, you did a great job, and I hope you enjoy the rest of your day.
Thank you. Thank you so much.